Let me give you the tea on health coaches. My name is Molly. I'm a certified personal trainer and, health coach. Today I want to go over what health coaches do, what we cannot legally do, and what to look for in a health coach that you follow on social media or that you're considering working with. So let's start out with what health coaches do. Health coaches serve as a source of unconditional support, accountability, and motivation while recognizing that you are the expert in your body. We specialize in behavior change, motivational interviewing, and goal setting, planning, and follow through. We can also provide general evidence-based health education on topics such as sleep, nutrition, exercise, and stress management. But we cannot provide specific personalized recommendations in any of those categories. Instead, we help you figure out what you're interested in focusing on and then help you follow through with steps to achieve your goals. We also attempt to fill something of a gap in the healthcare system right now where doctors and dietitians have so many patients and such a high workload that they can often only spend 15 minutes with each person that they see. So that's where a health coach might come in if they're partnering with licensed professionals. Let's say that somebody leaves their doctor's office with recommendation to start exercising or cut back on sodium or lower their cholesterol. They might not know what steps to take or what the options are to get there. Or maybe they do and they understand and they know what they have to do. This is really common, but when you don't see the doctor again for 6 months, it can be really easy to start off strong and then kind of fall out of the habit, or you might just be struggling to stick to those behavior changes when school, kids, work, illness, other things get in the way, and you need somebody who can dedicate a little more time to keeping you accountable and tapping into those internal motivators that can keep you going long after you're done seeing the health coach. Just generally our goal is to help you get to your goals, and we don't decide that for you. We're not going to tell you cut out processed foods, go vegan, do keto, try the, 12-3-30 treadmill workout. You're going to decide what's best for you, and that may evolve over time, but our job is to support you and walk side by side with you to help you get there. Now let's get to what health coaches do not do and cannot legally do. So if you see somebody doing these things, it's a red flag. We are not doctors, not dietitians, and not therapists. Sometimes health coaches have other certifications or other qualifications, but unless somebody blatantly states their other qualifications, then you can safely assume that they are only a health coach and therefore should not be doing the work of any of those other licensed professionals. So what does this really mean in practice? This means that while we can provide general guidelines, we cannot prescribe personalized, individualized nutritional recommendations or meal plans, nor can we recommend specific supplements. I think this is where I most commonly see people veering outside of their scope of practice, and that's people who are writing meal plans or making recommendations to people when they really aren't qualified to do that, and it can be dangerous, it's illegal, and it's not necessary. We can play a role in this field without kind of stepping on the toes of the people who have spent years working to get where they are. Health coaches need to be really aware of their scope and know when to refer out to other people. Ideally, health coaches should partner with these other professionals, have them in their referral network so that when somebody brings up something that seems out of scope, you can send them to somebody who's qualified to help them. What we need to be most concerned about is helping people get the best support that they need, and that's also recognizing when we can't fulfill that role. I hope that clears up what we can and can't do, but now let's talk about what should you look for if you want to work with a health coach, follow a health coach, or maybe even become a health coach. So many people can get an online certification calling themselves a health coach and then start working. But what qualifications separate somebody who just goes online and finds the cheapest, fastest, self-paced program out there with someone who has a little more sufficient training? I would recommend, if you're looking for the most qualified person, look for people who have NBC, HWC, or ICF credentials. I specifically am working toward the NBC, HWC, so I can't really speak about the ICF. but you can look that up separately. So the NBC HWC credential stands for National Board Certified Health and Wellness Coach. So ever since 2016, the National Board for Health and Wellness Coaches has partnered with the National Board of Medical Examiners to provide a little more robust of a certification process and more oversight in an otherwise very kind of a free-for-all field. If you hold the NBC HWC credential, it means that you've met a certain level of education, training, and assessment standards that set you apart and bring a little bit more legitimacy to the health coaching field as a whole. In order to even qualify to sit for the board exam, you need to pass an approved training program, which, mine lasted for about 6 months of just the education and practice portion. On top of that, you need 50 coaching sessions recorded in a coaching log. And then lastly, you need to pass the actual board exam, which happens a couple times a year. There are a lot of inconsistencies in health coaching programs out there. So if you go to the NBHWC website, it will list qualified or approved training programs that will allow you to sit for the national board exam. So even if somebody doesn't have that NBC HWC title, they might still have gone through an approved training program, and you can rest a little more assured that they have met some standard, and maybe they didn't feel the need to pursue that higher level credential, but they've met the standards that would qualify them to take it. So this is all just to say that I encourage you to check out people that you follow online or that you're considering working with, and if no certifications or credentials are listed, then it's a little sus. So anyway, let me know if your opinion on health coaches has changed throughout the course of this video. And if you're interested in talking more or to see if we might be a good fit for coaching, I will leave information in the description box. Thanks for watching.